Okay, let's unpack this then. Because this isn't just anatomy for anatomy's sake. This map, it dictates how you smell things, how you see, how you feel your face.
How you balance, even how you breathe
Uh-huh.
without thinking about it. It's all routed through here.
So where do we start the tour?
Let's start right at the front. The anterior cranial fossa. It's the highest level. It sits right behind your forehead and eyes.
And what's its main job?
Primarily, it's dealing with connections to the nasal cavity. Makes sense, given the location.
Okay, first opening listed here. Foramen caecum sounds small.
It is small, usually. Sometimes it's even closed off, but typically it transmits an emissary vein.
An emissary vein that connects the nasal cavity, so outside air, essentially, with the superior sagittal sinus inside. That sounds risky.
Well, yes and no. It's a potential pathway, you're right. Historically, infections could track along these veins, but their main job seems to be about pressure.
Pressure regulation between inside and outside the skull.
Exactly. A way to equalize things. It's a trade-off, like a lot of things in anatomy.
Right.
Structure versus function versus risk.
Interesting trade-off. Okay, moving from that small vein to something seemingly much more significant for senses. The cribriform foramina.
Ah, yes. Cribriform plate, really. It's not one hole, but like a sieve. Tiny perforations.
A sieve. Why so many little holes?
For smell. Each tiny hole lets through the fibers of the olfactory nerve, that's cranial nervi. They come straight up from the top of your nasal cavity.
So the scent molecules basically get a direct line to the brain. No waiting.
Pretty much the most direct sensory input there is. Straight from the nose lining, through the sieve, right into the olfactory bulb of the brain. No detours.
Wow. Just dedicated channels for smell.
Okay, and finishing up this front section, we have the anterior ethmoidal foramina.
Right. Carrying the matching artery, vein, and nerve, the anterior ethmoidal ones. They handle some connections between the orbit, the eye socket area, and the nasal spaces. Ties things together up front.
Okay, so that's the anterior fossa. Mostly smell and some connections nearby. But now, it feels like we're moving into the real hub, the middle cranial fossa.
Oh, absolutely.
Yeah.
If the anterior was a quiet front porch, the middle fossa is Grand Central Station. Major sensory pathways, motor control. It's busy.
Where do we start in this busy station?
Let's start with sight. The optic canal. Nice and clean, this one.
What goes through? Just the essentials for vision. Exactly. The optic nerve itself, cranial nerve 2, carrying all the visual information from your eye, and the ophthalmic artery, which is the main blood supply to the eye. Dedicated pathway.
Okay, clear enough. But right next door, the superior orbital fissure. This looks like a completely different story. The list of contents is huge.
It is. It's incredibly crowded.
Yep.
Think about everything your eye needs to do besides just see.
Like move, focus.
Exactly. So through this one single slot, this fissure, you have the nerves for almost all eye movements. Cranial nerve the third, the oculomotor.
Okay.
Cranial nerve the fourth, the trochlear, for that tricky downward and outward gaze.
Right.
And cranial nerve the sixth, the abducens, just for moving the eye outwards. All three packed in there.
3 separate nerves just for movement through one opening, plus more.
Oh, yes. Plus branches of the first part of the trigeminal nerve V1 that handles sensation for the forehead and eye area. And veins draining the eye, the ophthalmic veins.
Wow. That is functional density. It's amazing it all works without getting tangled.
It highlights how critical that space is. Any swelling or issue there can affect vision and movement dramatically.
Okay. And speaking of the trigeminal nerve, CNV, the big sensory nerve for the face, it seems to get its own dedicated exits here in the middle fossa, too.
It does. It's such a major nerve carrying so much information, it needs its own pathways. The second division, V2, the maxillary nerve.
That handles, like, the cheek area, upper teeth.
Yes, exactly. That one gets its own nice round exit. The foramen rotundum.
Rotundum, okay. And the third division, V3.
Mandibular nerve, the biggest branch. Handles sensation for the lower jaw, chin, tongue sensation, plus the muscles for chewing. That exits through the foramen oval.
Foramen oval. And looking at the source list for oval, it's not just V3, is it? Seems like other things are hitching a ride.
That's right. Oval is another busy spot. Besides the massive V3, you've got the accessory meningeal artery.
Supplying the dura, the brain covering.
Part of it, yes. And the lesser petrosal nerve. Now that one's interesting.
Why is that? It's a branch of CNIX, glossopharyngeal, right? What's it doing way up here in V3's exit?
It's taking a detour. It's carrying autonomic fibers, parasympathetic, that are ultimately heading for the parotid salivary gland down in your cheek. It just happens to jump across and exit through oval.
So these foramina aren't always exclusive. They're like shared utility tunnels sometimes.
Exactly. Pathways of convenience, you could say. Plus, often an emissary vein connecting to the pterygoid venous plexus outside. Oval is complex.
It really shows the interconnectedness. Okay, another one listed here. Sounds small, but maybe important. Foramen spinosum.
Ah, spinosum. Tiny hole, huge clinical relevance.
Why? What goes through?
The middle meningeal artery.
Yeah.
And a small nerve branch, the nervus spinosus. But it's the artery we really focus on.
Okay. Why is that artery so critical?
Because of where it runs. After passing through spinosum, it runs up on the inside surface of the skull, just underneath the bone, particularly in the temporal region, the side of your head.
Right near the surface then. Vulnerable.
Extremely vulnerable to fracture. If you get a hard blow to the side of the head and the temporal bone fractures, this artery can tear.
And if an artery tears inside the skull?
That's an epidural hematoma. Arterial blood pumps out fast, under pressure, stripping the dura away from the bone, creating a rapidly expanding blood clot that compresses the brain. It's a surgical emergency.
And foramen spinosum is its entry point into that danger zone.
Got it. That makes the anatomy suddenly very real.
It does. Knowing where spinosum is and what passes through is vital.
Okay, last bit in the middle fossa involves the main blood supply to the brain itself, the internal carotid artery, the ICA.
Yes, the ICA needs its own pathway. It enters the skull base through the carotid canal.
So the canal transmits the artery. Anything else?
Yes, it also carries a network of sympathetic nerve fibers that sort of hitch a ride on the artery, forming a plexus around it. Autonomic control heading inwards.
And then there's this other opening nearby, the foramen lacerum. Does the ICA go through that too? Not quite. The ICA travels over the top of the main part of lacerum, which is actually filled with cartilage in life. But important sympathetic fibers, the deep petrosal nerve, do run through the area related to lacerum, joining up with other nerves.
So the whole carotid entry zone is this complex mix of major artery plus autonomic nerves, all integrated before they really dive into the brain structure.
Precisely. It's setting up the brain's main fuel line and some of its control system right at the gateway.
Okay, wow. That middle fossa was intense. Now we move back again to the final section, the posterior cranial fossa.
We do. We're moving down and back. This fossa sits lowest and deepest right above the nape of your neck. It houses the cerebellum and brainstem.
And the openings here relate to?
Hearing, balance, vital functions like swallowing, controlling heart rate, breathing, and critically, the main exit for the spinal cord.
Okay, first stop in the posterior fossa. Internal acoustic meatus. Sounds ear-related.
Definitely. Think internal ear canal. This short tunnel carries two crucial cranial nerves.
Which ones?
Cranial nerve 7th, the facial nerve, which controls all your facial expressions, plus taste and salivation.
Okay.
And cranial nerve 8th, the vestibulocochlear nerve, that's the one for hearing and balance, comes straight from the inner ear structures.
So hearing, balance, and facial movement all depend on nerves squeezed into this one bony canal. Along with their blood supply, the labyrinthine artery.
That's right, it's another tight spot. Issues here, like a small tumor, can cause hearing loss, vertigo, facial paralysis, a whole cluster of symptoms because everything is bundled together.
Makes sense. Okay, next up, the jugular foramen. This sounds important just by the name, jugular vein.
Yes, but so much more. If the superior orbital fissure was busy for the eyes, the jugular foramen is the critical junction for staying alive almost.
That sounds dramatic. What goes through?
3 vital cranial nerves exit the skull here together. Cranial nerve INX, the glossopharyngeal.
Involved in swallowing, taste, salivary glands.
Correct. Then cranial nerve X, the vagus nerve, the big one.
The vagus. Isn't that the one that wanders all through the chest and abdomen, controlling heart rate, digestion, voice box?
That's the one. Absolutely essential for autonomic control. And finally, cranial nerve exhalava, the accessory nerve, which controls major neck muscles, like your traps and sternocleidomastoid.
So IX, X, and XI all squeeze out through this one opening.
They do. It's an incredibly dense bundle of critical nerves. And that's not all.
What else?
Like the name suggests, it's a major venous exit. The sigmoid sinus and the inferior petrosal sinus, huge veins draining blood from the brain, converge and exit the skull here to become the internal jugular vein in your neck.
Wow. So 3 vital nerves plus the main venous drain for that side of the head, all sharing one complex, irregularly shaped hole.
Exactly. It's one of the most complex and functionally loaded openings in the entire body. Damage here is catastrophic.
I can imagine. Okay, almost at the end of our tour, just before the main exit, there's the hypoglossal canal.
Right. A smaller canal dedicated to just one nerve.
Which one?
Cranial nerve 12, the hypoglossal nerve. Its job is purely motor control of the tongue muscles.
Essential for speaking clearly and swallowing priorly, then.
Absolutely. You need precise tongue movement for both.
And finally, the biggest opening of them all, the main event, foramen magnum.
Foramen magnum, the great hole. This is it, the connection between the cranial cavity and the spinal canal.
What passes through this ultimate gateway? It must be a lot.
It is. Most importantly, the brainstem transitions into the spinal cord here. Specifically, the medulla oblongata passes through.
The medulla. Controlling breathing, heart rate, blood pressure, basic life support central.
The very definition of vital. Also passing through are the vertebral arteries, ascending into the skull to supply the back part of the brain.
So blood going up alongside the spinal cord going down.
Yes. Plus, the spinal roots of the accessory nerve, CNI, actually travel up through foramen magnum before joining the cranial part and exiting via the jugular foramen.
That's a weird route.
It is. And you also have spinal arteries, membranes like the tectorial membrane continuing down, ligaments, it's the major thoroughfare. Everything has to pass smoothly between brain and body here.
So wrapping this up, we started with what seemed like just a list of holes in bone. And what we've actually mapped out is this incredibly complex, organized infrastructure: sight, smell, sensation, movement, hearing, balance, vital functions, all routed through specific pathways, organized across these three fosses.
Exactly. The anterior for smell and front connections, the middle is a central hub for vision, facial sensation, and chewing, and the posterior for hearing, balance, vital autonomic control, and the main connection to the body. It's highly structured.